Over the past 15 years, public health authorities have downgraded recommendations for the prostate-specific antigen (PSA) test as a screening tool to reduce the overdiagnosis and overtreatment of men with low-grade prostate cancer. Now, researchers from Weill Cornell Medicine have found that while these efforts have been effective, the incidence of higher-grade disease and metastasis at diagnosis have risen. The research was published March 22 in the Journal of the National Cancer Institute. To our knowledge, this is the first study to demonstrate nationally that low-grade prostate cancer is no longer the most commonly diagnosed type of prostate cancer, said senior author Dr. Jim Hu, the Ronald P. Lynch Professor of Urologic Oncology at Weill Cornell Medicine and Director of the LEFR. For their study, Dr. Hu and colleagues identified more than 438,000 men with newly diagnosed prostate cancer between 2010 and 2018 using a nationally representative database. One measure was the Gleason grade, a pathology score based on the microscopic appearance of the prostate cells, determined at biopsy and after radical prostatectomy, a procedure in which the entire prostate is surgically removed. Additional measures were PSA level and presence of metastasis at diagnosis. They also investigated whether increasing rates of obesity or the advent of newer diagnostic tools such as pre-biopsy magnetic resonance imaging (MRI) and biomarkers might explain incidence trends. The analysis revealed a significant decrease in the incidence of the lowest-risk prostate cancer, Gleason grade 1, GG1, falling from 52 to 26 cases per 100,000 men across all age groups. Further, the proportion of GG1 found on pathology in men who had a radical prostatectomy decreased from 32 to 10%. However, metastasis rates at diagnosis increased from 3.0% to 5.2% over the same period. The fact that only 10% of radical prostatectomy specimens demonstrate low-grade prostate cancer indicates that even when low-grade cancer is diagnosed, it is being treated much less frequently, said Dr. Hu. This demonstrates that there has been acceptance of active surveillance, also known as monitoring with curative intent, among doctors and patients nationally. It is encouraging to see that urologists in the United States have moved away from overutilization of radical therapies for the management. Public health authorities should consider implementing risk-stratified screening, such as MRI or biomarkers, continuing to minimize overdiagnosis and avoid biopsy in men with low-risk prostate cancer while addressing the rising trends of high-grade and metastatic prostate cancer, the authors conclude. Make a difference. Sponsored Opportunity Story Source. Materials provided by Weill Cornell Medicine. Note: content may be edited for style and length. Thanks for watching. Please subscribe my channel for more videos.